Hello, my name is Dr. Brett Van Norman, Advanced Pain Centers in Singapore. And I was creating this video here just for people that are thinking about doing a spinal surgical procedure, usually related to a disc problem. Degenerated disc is the most common. And I'm going to show you what I talk to my patients about in the clinic, or what our doctors do in the clinics. Our main goal, I would say, is to try to prevent any kind of surgical procedure if we can. There are of course appropriate times for there to be a surgical procedure, and we definitely refer out for those cases. However, a vast majority we find we can help prevent, and what I'm going to do is show you what we do in the clinic. And we'll start with what the most common types of symptoms really are with a disc problem, and we'll talk about mainly the lower back here today. And it starts usually with a dull lower back pain. It can be on and off, usually persistent over time, just sort of gets closer and closer together as far as how often it flares up. And eventually it breaks down into a point where even over-the-counter medications aren't really helping. And it starts to move from the lower back into the bum or even into the leg. Some people wonder if it can be a disc problem if they don't feel any back pain, and the answer is yes. We see all kinds of different cases where it can just be in the lower back, but very commonly there's no lower back pain, and it's really some sciatic pain into the bum and down into the leg, and it can even skip all those places, including no back pain, no bum pain, but even just pain into the calf. So these are the common symptoms, I would say, with a disc problem. And what we mean by a disc problem usually is something called a prolapse disc. What that looks like, this is a side view, and we'll just say this is the lumbar spine. And if this is the spinal disc and this is the bone, what a prolapse disc, or what people refer to as a slip disc, what it looks like is really just a compression of that disc. There are these little micro tears that develop in the disc over time for various reasons, but we refer to this as a degenerated disc. And once those tears are there, you can imagine the integrity of the disc itself is then compromised, which now we have our body weight and gravity consistently pushing down. And when that happens, again, over time, is that usually it's a slow and steady process. And eventually it ends up compressing the nerve, which comes through this space here. This view, this is a bird's eye view or cross section here, where we'll go back to a normal. So there's two parts. There's this, what we call the nucleus, which is like this jelly substance. Think of it like a jelly donut almost, where the outside layer is sort of holding in the jelly. And once those tears start developing, again, the integrity of the disc goes down, and that jelly inside is then squeezed out. Think of it almost like an ice cream sandwich, where you have the two cookies and the ice cream in the middle, and we go ahead and push down those two cookies. The inside here is going to have to squish out somewhere, and it usually ends up going up to the back. This is the back, and the nerve, of course, is here. This is the left nerve, and this is the right nerve. So one of the common questions I'll get from people is, why is it one-sided? So a lot of people will have pain just on one side, just going down the left leg. So maybe it's just one-sided. Maybe it's the right side, maybe it's the left. And why is that? Well, it'll show here for the reason for that. So here's a situation where it would be compressing the left spinal nerve and affecting the left leg, or this is the right leg situation. It could even be just central. So all three scenarios are possible. So what do we do about this? Well, there's a special table that we use in our clinics. We have three different types of this table, which is called the decompression table. And in essence, we want to just decompress the spinal nerve. So I'll go back here. If we're talking about, again, the main problem of this particular condition being a compressed disc or a nerve compression. Remember, this disc is putting pressure on the nerve, or it could be a combination of the bone, the disc, or the inflammation or swelling of the joints around the area here. But the problem is nerve compression. So if this is the skin of the back here, and in between we've got muscle and fat before we get to the spine itself. What I talk to patients about is just the common sense. When we talk about the actual problem, the solution becomes just self-evident. So if it's compressed, does it make sense if we take a pill? This is me trying to show digestion here. This is a pill. Does it make sense for us just to take a pain medication? Does it affect the actual problem? No, it just simply covers up the symptom. What if we put some needles, some acupuncture needles in here? Would that affect the core problem? Well, it does help a lot with inflammation and tension, but is it affecting this? No. What about massaging? Same thing. So, and the last actually is exercise. So if we do some physio and just start exercising these muscles here, is that going to change this? Now again, it has all of those, especially the natural ones here, have tremendous benefit, and we even do some of them in the clinic, actually all of them. And there's various reasons to do them and times to do them. However, if we're not addressing the core problem of compression, we know that it's going to be a temporary thing. So I'm going to go back to, here's another picture of the treatment of the decompressing of the spinal disc. And the machine does move up and down. It's sort of part of the protocol of the decompression. And one of the most common things that will come after I talk about this is, well, if you're decompressing on the machine, once I get off, won't I just compress again? And the truth is, in the beginning, yes, that's likely to happen. The disc is still quite unhealthy, and it needs time in order to heal. It needs repetition and time in order to build up back some of that strength that we lost. If we go back to this guy. So yeah, coming off these micro tears, they do need time to heal. And so in the beginning, yes, it's true that even if when we left off a little bit, it's going to come back. So we talk about in the initial visit or two, there being really sometimes quite a bit of relief in the very beginning once you get up and once you finish the treatment. And it doesn't take long for it to come back, maybe even the next day. And what we do is we look to build that up over time, and which does happen. In fact, I wanted to show one of the studies. This is from the Mayo Clinic, from one of the particular decompression machines that we use. They did a pretty comprehensive study here in the Mayo Clinic, which of course is a well-renowned clinic. And prior to starting, the average score of pain score was 6.4 out of 10. So, you know, not severe, but pretty good level of pain, moderate. By the end of the 6-week program, they went down to a 0.8 on the scale of 10. So tremendous amount of improvement just from 6 weeks of treatment under what is called the DRX treatment table. These are something that our clinics have, every clinic. And again, this is just a 6-week course and no adverse effects from this. There was a study that I saw recently. It was from 2014 from a Harvard Health Journal on the effects of spinal surgery, lower back spinal surgery, fusion surgery. And let me show you a picture of what that looks like actually. So this is what it would look like. The screws are actually inserted into the bone. It could be 2 to 4 levels usually. And there was a doctor from a Harvard clinic actually talking about how it doesn't really cure the problem, which we've been saying for a long, long time. In fact, he talks about it being no better than any kind of conservative care. Now, the conservative care, granted, does take longer. So you go in for a surgical procedure and you're in and out, and it's sort of done. You're done in hours. This is the fusion is finished. However, we will say that rehabilitation, even after surgery, will be months to years. And conservative care can sometimes take upwards of a year depending on how severe things are. So it's true that there is a time factor, there's a cost factor. So sometimes the insurance companies and the government can cover a surgical procedure, whereas a lot of times they don't cover conservative care, which is, to me, maybe a little bit backwards, but that's just life. That's just the way it is. So let's get back to, okay. So as far as our treatment goes, again, over time, we look to rebuild some of this disc to bring it back to closer to normal. Now let's look at the degeneration, the actual process of degeneration in the lower back. And this is what this looks like. So normal, this is a side view normal. And usually this is a 10, 20, 30, 40 year process here. And you can see the nerve here is just getting more and more impinged over time. And the sooner we can see a patient in this process, the better. And what we find is that a huge majority of patients do not even know that this process is taking place. One is that they might not even feel any of it. Symptoms can be very late in showing up. But for the most part, it has to do with patients feeling a pain, but it not being severe enough to do much. Meaning a pill fixes it enough to just get on with life. Or it doesn't happen that often, even if it is more painful than just an over-the-counter pill taken care of. Maybe it only lasts a day or a few hours, and then it's gone. I just rest and it's gone. But the more that we let this degeneration go, we find the closer and closer these flare-ups or these times of pain come. They come closer and closer together. And they get usually more and more intense, so that even prescription medications eventually are not doing anything. And then that's usually about the time we look and we see something like this happening. And quite often people are shocked to see this. So this is generally the process of why people are going to be coming in for disc prolapses. It's true that it can happen from an injury or a fall or an accident. But in our clinics over the past 20 years, that's maybe about 5%, maybe 7%. I would say the vast majority have to do with a degenerated disc. As far as the neck, same type of deal. The pain can move into the hands, and depending on the nerve root, it can get quite specific. But it's the same process actually, and a lot of times people are having them at the exact same time. So again, we have some sort of compression, whether it's moving into the left arm. Remember, this is the left side, this is the right side. Here's the spinal cord, by the way. And so this would move into the left arm if compression is, usually it has to do with the severity of the compression, the further away it goes, not always, but most of the time. And of course, this would be the right arm. It could also go into both. Same situation here as the lower back. And the procedure is very similar. So we'd want to decompress. And if we're worried about, one of the other main comments and concerns that we get from people has to do with, well, especially if it's your mother or your father, or you're 60, 70, 80 years old and you're watching this, are my bones strong enough? The doctors at our centers are very much trained to know what is safe and what's not. And we always start off with an extremely low setting depending on your weight. So in fact, many times in the beginning, people will say, I don't feel much of a pull. when we're pulling, say, oh, I don't feel much. And then we say, that's okay. This is how we want to start. We want to slowly build your body up. We want to see the tolerance levels of what your surrounding muscles and tissues can also accept. We don't want to, basically you don't want to overdo it in the beginning. And so yes, we're very, very careful when it comes to this. So again, I'll go through that neck. Here's what it looks like. And again, the machine actually doesn't just pull and keep you there, it does move up and down. We're really pumping the disc. I wanted to show what it looks like. So here are some MRI pictures. So this is a side view of the lower back, and this is the back here. This is the back, this is the front, and these are the bones. This here, you'll see it says it's a normal disc. So the color here on an MRI is very light, it's white. This means it's got lots of fluid inside of it, which we really want. This here is the degenerated one. This is the bulge. So this is the spinal canal here. The gray here is the spinal cord. You can see the healthy one. There's nothing coming out here. There's nothing interacting with the nerve roots. Whereas here, we have this bulging disc coming out, and the color of it too. It's more gray, and some of them can be quite black. Here's another disc coming out. So that's a visual of what it looks like. Let's see if we can get back here. I've lost it. Okay. All right. So what can we do to prevent spinal surgeries? We have very specialized tables designed for this. Again, we have 3 different types. One specifically has a lot of different studies on it, but they've all been in our clinics for 10 to 20 years, the various machines. Very, very proven. We're talking about thousands of patients over the past 20 years. And it's something that, again, we would highly recommend you look at. Having someone from one of our clinics look over your condition before you're even thinking about a spinal surgery. I'm going to pull that up again. So this is, and of course, this is not the only spinal surgery that's out there. There's more minor ones, the discectomy. But I'm going to go back to. So a discectomy, what it does is it actually takes out the pieces of the bulging disc. So if you look again at a healthy disc color and the degenerated, so these are dehydrated or degenerated discs, when we talk about a surgical procedure, even the most basic, the least invasive surgeries, the microdiscectomies, they're taking out these pieces. And I always ask patients, what do you think happens once these pieces are gone? How's the rest of the disc? How does that look? And we can even go back to this picture of, let's say it's a left side disc bulge. So they'll cut off this piece here that's touching the nerve. And granted, it's usually quite successful as far as feeling better, because they've decreased the compression, right? Remember we talked about the simplest way to look at this has to do with it's a compressed nerve. So by cutting off the disc, you're decompressing the nerve. However, we haven't changed the health of the disc whatsoever, which is what the spinal decompression in the clinic is doing. So I'm going to leave it at that for now. We've got a lot of information in there. If you have any questions for me, you want to ask anything, just you can put it in the comments. Feel free to email me, and if I can answer anything and prevent you, hopefully, from getting a surgical procedure, then that's our goal. We really want to help people do that in a very safe and effective way. So thank you for watching, and stay tuned for more videos. Thanks a lot. Bye-bye.